Hey there, once again. We're almost done. We are continuing with our conversation on the venipuncture procedure in Chapter 8. In this section, we're going to cover the steps 13, 14, and 15, which are placing the gauze, removing the needle, activating your safety feature, and applying pressure in step 13, followed by step 14, which is discarding the collection units, all your equipment that was used, syringe needles with transfer devices, and lastly, labeling your tubes, okay? So you have your tubes already filled out, you inverted them in the previous steps, you place them in your rack, all right? And you've done collecting your specimens. What do you do now? Okay, so you've already released your tourniquet, okay? What you're gonna do is you're gonna get your gauze that you have prepared for the patient, you're gonna apply it over, place it over the needle site, okay, the insertion site, and very carefully, gently, you're going to remove the needle and almost at the same time, apply gentle pressure, okay? You want to make sure that you apply pressure so that the patient does not bleed. At this point, you have your sharps right here. You can apply your safety feature at the same time. I've applied safety feature, and you can ask the patient, can you apply pressure to the site, please? So the patient applies pressure. Now you're going to discard your equipment, okay, your units. So your multi-sample needle, your tube holder, must be discarded in one unit, okay, including any other material that was used, whether it be a syringe or a multi-sample needle, a butterfly. Everything has to go in the sharp container, all right? These are biohazardous material, they're sharps, and they need to go in that container, okay? So once you've done that, you dispose of it, you've asked the patient to continue to apply pressure, right? Now, don't forget, they have to apply pressure and keep that pressure on until you instruct them otherwise, okay? So do not press down on the gauze while the needle is still in the vein. Please don't do that. That is painful. It's gonna, could also potentially present a risk, a hazard to you because you might get stuck with the needle. So do not apply pressure when the needle is in there. Do not apply pressure to the gauze while the needle is in there, please. It's very dangerous, okay? Now, when you apply a gauze, most patients will immediately start to bend their arm, right? That's what they've seen, and that's what they will automatically do. Now, this is contraindicated, but as we know, when eventually when they extend their arm once again, those blood plugs that are there stopping the bleeding will be released, and they may start bleeding once again. So you've asked the patient to apply pressure, okay? At the same time, you could be putting your equipment away, okay, or doing other duties, okay? But please, again, keep your eye on the patient, make sure they're doing okay. You know, can simply ask them how they feel, and if fine, that's great, okay? You can discard your units, your syringes or needles at the same time. At this point, you can actually continue to label your tubes, all right? So you're gonna grab your tubes with your labels and you're gonna put them on the specimens, and you're going to show them to the patient. And you ask them, is this you? And they're going to read the label, if possible, or maybe a caregiver that's with them. Is that your name and date of birth? You say yes, okay, right away. Next one, put the label on, is that you? Yes, and so on. Okay, this is what we call the three-way identification. All right, this way you know for sure that you identified the first patient from the very beginning. All right, and you've also labeled the specimens correctly. Okay, it's very disturbing when you leave the room and the patient has you think you might have labeled incorrectly. Okay, it can really, you know, do a game on your brain. So this ensures that you can leave in peace, knowing that you correctly labeled the specimen with the right patient, okay, at the bedside. So super important that you do that. Okay, now before you dispose of equipment, if you use a syringe, okay, remember the safest way to transfer the blood from the syringe to a vacuum trainer is by using a transfer device, okay? It's a very small adapter that goes onto the needle, okay, and it adapts to a tube holder with a multi-sample needle collector, and then you can transfer the blood into the vacuum trainers as we've done in the clinical, and we will continue to practice that, all right? So again, please make sure that you follow these steps down to the letter, because this is what keeps us safe, what keeps the patient safe, and overall have good outcomes. These are all CLSI guidelines, okay, that we follow, and this is what you're going to be tested on in the national certification test. So every step that we've covered, please make sure that you ask any questions. If you didn't understand something, I will more than gladly elaborate on the specific step of the venipuncture procedure. So with that said, we are actually done with the steps of the venipuncture process, which is completely chapter 8. So I hope that you understand the process and the reasons why we do things the way we do. And again, so please, this will ensure that you are a safe and competent phlebotomist and ensure the safety of the patients in general. Thank you. We'll continue on your next section.